on my mind. Smallness is a good time. Neighbor and some little children. I'm in the singing and the dancers really admire them. Smallness is still on my mind. Smallness is a good time. Neighbor and some little children. I'm in the singing and the dancers really admire them. Yes, they're singing. Ching, ching, ching.
Round of applause to the team at the Guyana Mental Health and Wellbeing Conference for their launch this morning. So as we proceed with the program, you'll notice it on our screen. We have quite a few notable persons on the program and of course in the audience. So I'll just ask that you permit me a few minutes before each presentation so that I can introduce those persons to you so that we're all familiar with each other. So as I begin today, it is my pleasure to firstly introduce His Excellency Mark Berman, the High Commissioner of Canada to Guyana. High Commissioner Berman presented his credentials to the President of Guyana in February 2021. He is a lawyer by training and he's been working with the Government of Canada since 1989. He has held several high-level positions within the Government of Canada, and his most recent post being the Director General of Consular Policy before coming here as our High Commissioner. At this point in time, I want to ask you to join me in welcoming High Commissioner Mark Berman as he delivers the opening remarks.
Good afternoon. For those that I addressed earlier, it's good to be back. Honorable Minister of Health, Dr. Frank Anthony, representatives of the International Development and Relief Foundation, IDRF, representatives of Columbia University, United Nations colleagues, all, senior members of the Ministry of Health and other government ministries, representatives of stakeholders and non-governmental organizations, members of civil society, members of the media, ladies and gentlemen. I am indeed extremely honored to be here this afternoon to join with you and with the Government of Guyana and our implementing partner, the IDRF, to officially launch our mental health project here in Guyana. Before I go on any further with my remarks, I would like to direct you attention to the central screens for a message from Canada's Minister of International Development, the Honourable Harjit Sajjan. Thank you.
Thank you for inviting me to join you today to help launch this very important new initiative. I'm pleased to announce that Canada will contribute $2.9 million to help address mental health in vulnerable communities in Guyana, in partnership with the International Development and Relief Foundation. IDRF is a well-known and trusted Canadian partner. Their healthcare services have impacted more than 200,000 people worldwide. This project will leverage their deep knowledge and experience to help build a stronger, more sustainable mental health system in Guyana. Today's launch also marks Canada's first mental health project in the Caribbean region, and I am heartened to see mental health care gaining more attention as part of our international development programming. Making mental health care more accessible is a priority for our government, in coordination with the Government of Guyana. Too often, people struggle with mental health challenges in silence. The stigma often associated with seeking mental health care can act as a barrier that stops people in vulnerable situations from coming forward. And if they do take that courageous step to ask for help, we want to make sure that there is appropriate and effective mental health care available to support them. We know that Guyana has one of the highest suicide rates in the world. Mental health is especially challenging for young people in local communities. This is not a fact that is shared lightly. Behind every number, there is a person who struggled, and there are families and communities who are grieving their loss. We know that mental health challenges can have a profound impact on other aspects of a person's life, on their education, on their ability to seek out and keep a fulfilling job, on their physical health, and on their safety. Making mental health care more accessible will help all people realize their full potential to make meaningful contributions to their families and their communities. For mental health projects like this one to be effective, we recognize that local knowledge and experience is essential. Development programs must be tailored to respond to local needs. That's why IDRF will work directly with local NGOs to deliver a community-oriented approach to care that isn't a one-size-fits-all solution, but instead relies on the proven strengths of community health workers. It will also work in partnership with mental health survivors, faith leaders, and community members in order to diversify the avenues of help and promote conversations about mental health in their communities. This project will also complement the extensive work of the Government of Guyana. The Ministry of Health continues to work tirelessly to address mental health and foster resilience for citizens. This project builds on and supports those efforts. So thank you for your participation in this conference and for your ongoing efforts to bolster mental health support. Together, we will chart a new path of mental health resilience in Guyana.
As an aside, you would know the one name that I trip over is my own minister, but thank you for that. Minister Sajan's announcement of this project speaks to Canada's commitment to working with the Government of Guyana to help strengthen and improve the health sector, and particularly the mental health sector in this instance. Further to the minister's message, please allow me to add a few more thoughts. Let me start by saying that I will not be doing two things today. Firstly, I will not be referring to the project by name again, since as you can see, it's quite a mouthful. And secondly, I will not go into the specifics about the project itself. I'm going to leave that to the capable hands of our friends from IDRF. Instead, I would like to talk about mental health in more general terms and why Canada invests in a project like this one in countries such as Guyana. The global mental health landscape has shifted significantly over the last few years as governments and international organizations have started to prioritize mental health in both their national and international agendas. The World Health Organization estimates that globally 1 out of 4 people will be affected by mental or neurological disorders at some point in their lives. Globally, mental disorders are the leading cause of lost economic output, with an estimated cost of nearly $2.5 trillion US annually, a figure which is expected to more than double to US $6 trillion by 2030, as the World Bank has estimated. Through various lines of treatment and availability, nearly 2/3 of people with known mental disorders never receive help from health professionals, largely due to stigma, discrimination, neglect, and or lack of access to services. All age groups and communities are impacted, but particularly vulnerable groups, including women who have experienced gender and sexually based violence, people in fragile and conflict-affected situations, and adolescents, particularly adolescent girls aged between 15 and 19, among whom suicide is the leading cause of premature death worldwide. The COVID-19 pandemic and the impact of climate change has exacerbated the prevalence of mental illness and substance abuse, which has in turn led to reprioritization of the global need for mental health promotion services and research. Global discussions have now advanced to include mental health in pandemic response and recovery, including a strong focus on populations living in vulnerable situations. The magnitude of the mental health burden is not matched by the size and effectiveness of the response it demands. Though many disorders can be prevented or successfully treated, 2/3 of countries allocate 1% or less of their health budgets to mental health, with the poor often bearing the greater burden in terms of risks and lack of access to treatment. Targeting mental illness for prevention and early identification and treatment reduces costs and consequences of long-term disability on the economy, the labor force, and community relations. Over the last 2 to 3 years, Canada has seen rising levels of mental illness, particularly depression and anxiety. We therefore recognize the importance of tackling the problem of mental illness both at home and globally. Canada is providing funding worldwide to experienced partners such as the IDRF to ensure mental health and psychosocial support is available to those who need it most. For example, we have partnered with Grand Challenges Canada to support one of the largest portfolios of global mental health innovations in the world, investing over 57 million Canadian dollars to support 124 projects in 42 countries. Grand Challenges Canada is a Canadian nonprofit organization that seeks to develop and scale high-impact innovations that support the mental health needs of underserved individuals, in particular young people in low and middle-income countries. Against this backdrop, Canada is therefore pleased to support this project here in Guyana, which seeks to strengthen, working with the government of Guyana, mental health resilience in schools through provision of counseling and community-based mental health care, as well as reintegration of patients with mental illness back into their communities. As some of you may know, IDRF has been working in Guyana for over a decade on initiatives such as educational support for orphans and vulnerable children and relief efforts for victims of flooding. Recent events such as the pandemic, as well as the flooding, have highlighted the need for increased and targeted interventions in the area of mental health. The design of this project was informed through consultations with a wide range of local stakeholders, particularly the Ministry of Health and the Minister himself. The project is therefore a truly collaborative effort between Canada and Guyana that seeks to holistically address a broad spectrum of mental health challenges and reduce the associated stigma. Despite mental health being a new area of programming for us in Canada, not only here in Guyana, but in the Caribbean region as a whole, Canada was extremely pleased to support this project, given its strong alignment to the human dignity pillar of our feminist international assistance policy. Under this pillar, Canada's investment seeks to improve the quality of health and health-related services to the poorest and most vulnerable populations across the world, and in so doing, contribute to the attainment of Sustainable Development Goal number 3, good health and well-being. At this point, I'd like to again commend the Government of Guyana for recently passing what has been described as a comprehensive and transformational suicide prevention bill 2022 just last week in the National Assembly. The bill seeks to, among other things, comprehensively address suicide and mental health promotion and care across a number of institutions through government collaboration and cooperation. I want to reiterate that our project with IDRF is intended to complement local efforts and was designed in anticipation of many provisions covered under the bill. I'm therefore confident that I also speak for our friends at IDRF that when I say we are invigorated by the passage of the bill and stand ready to support the Ministry of Health and other agencies in Guyana as they forge a new path to mental health resilience. In closing, I wish to thank you all for your time and attendance here today, and I really do look forward to your continued cooperation as key stakeholders as we work together to achieve the objectives of the project. Thank you, and do enjoy the remainder of our program here this afternoon. Thank you very much.
Thank you very much, High Commissioner Berman. At this point in time, it is my pleasure to introduce Mrs. Yasmina Mohammed. Mrs. Mohammed is the co-chair of the International Development and Relief Foundation. She currently works as an arbitrator, an adjudicator, mediator, and workplace investigator in the areas of labor, employment, and human rights. Mrs. Mohammed has worked as an adjudicator at the Human Rights Tribunal of Ontario, the Ontario Labor Relations Board, and the Immigration Refugee Protection Board of Canada. Ms. Mohammed will be delivering remarks on behalf of the board of the IDRF. Please join me in giving her a very warm welcome.
Good afternoon, and thank you. Honorable Minister of Health, Dr. Frank Anthony, His Excellency Mark Berman, High Commissioner of Canada to Guyana and Suriname, representatives of the International Development and Relief Foundation, representatives of the Columbia University, the Deputy Representative for UNICEF, Irfan Akhtar, other representatives of United Nations agencies, senior members of the Ministry of Health and other government ministries, representatives of stakeholders, non-governmental agencies, members of civil society, members of the media, and ladies and gentlemen. Thank you so much for having me here with you in Guyana. As mentioned, I am the co-chair of IDRF. Yasmina Mohammed is my name, and I am representing the board today. I have been involved with IDRF for the past 22 years. And I'm proud to say that IDRF is a Canadian charitable organization that empowers the world's disadvantaged people by providing local humanitarian aid and long-term sustainable development programs. Our values are based on three or four core principles. And the first is human dignity. The second is self-reliance. The third is sustainability. And the fourth is social and economic justice. In 1984, we started out as an international refugee and relief program, which helped sponsor hundreds of refugees to Canada. However, we soon realized that while there was a need to respond to the refugee crisis, there was a greater need and a more pressing need to address and find ways to combat and overcome the underlying causes of vulnerability and poverty, and even the need for refugees. The primary goal then shifted to development, and we renamed ourselves the International Development and Refugee Foundation. The focus was then helping people at the grassroots level and to address the more long-term needs of improving the quality of life through development programs and education. In 2000, we morphed into the International Development and Relief Foundation. We became fully cognizant that human dignity is the foundation of all humanitarian work, and human dignity to us as a board translated to self-reliance, good education, good health and well-being of humanity. Hence, we focused on development programs that improve the quality of life, education, and health. We respond, we recover, we rebuild by partnering with local government, local organization, and NGOs to balance relief efforts and long-term sustainability in the hope of growing self-sufficient and resilient communities. As an organization, we are committed to transparency and programming impact. IDRF ensures 91% of each donation goes towards our programs. We are amongst the best administrative percentage in our sector. IDRF has also been awarded a top 100 charity for the last 5 years by Charity Intelligence. And we are also named the leading 25 charity by the Financial Post for our excellence in financial accountability and transparency. As a board, our philosophy is to ensure that our programs uphold the principles of human dignity through transparency, accountability, and most of all, fairness. As co-chair, I aim to ensure that everyone here understands that IDRF is committed to the incredible work of our team in implementing this mental health program in Guyana. We have partnered with various ministries, several local organizations, hired local staff, and have been guided throughout by the leadership and needs of the government of Guyana to implement this long-term mental health project. I want to convey a special thanks to the government of Guyana, the Ministry of Health, Education, Human Services, and Social Security, to our local partners, the Islamic Organization of Guyana, and Women Across Differences, the Tubase Medical Research Center. I also want to thank the Canadian government, Global Affairs Canada, and the entire staff at the Canadian High Commission to Guyana. I also want to thank, of course, the University of Melbourne for our technical and technical support, Dr. Tayyip Rashid, and most of all, I do want to thank our own staff here in Guyana and Canada for their immense work in this incredible mental health project. I do, in the presence of all of the esteemed guests and speakers, it does provide me with hope for the future And I wish all of you in this endeavor, I wish you all the best and success, and wish that your challenges become easy. And at the end of the day, like, and pardon me, I forgot the name, but to take you off the suicide list at the end of the day. So I do hope for that. But thank you very much for giving me the time.
Thank you very much, Mrs. Mohammed. Our next speaker will be Mr. Mahmoud Qasim. Mr. Qasim is the Chief Executive Officer of the IDRF. He is an experienced fundraiser, philanthropist, and nonprofit executive. He has built a successful career working in both Canada and Asia as an international development and projects manager. And he joined IDRF in 2019 and has been recognized for his tremendous humanitarian work. Please put your hands together and join me in welcoming Mr. Qasim.
Greetings, Honorable Minister of Health, Dr. Frank Anthony, His Excellency Mark Berman from the High Commission of Canada to Guyana and Suriname, representatives of IDRF, our staff and our team, other representatives of the United Nations agencies, the Department Representative for UNICEF, Irfan Akhtar, senior members of Ministry of Health and other government ministries, government organizations, members of civil society, members of media, ladies and gentlemen. Thank you for being here today for the launch of this program over the next 5 years that IDRF will be working on implementing here through our local partners. IDRF is not new to Guyana, and it is probably a name that you may not have heard, and that's because IDRF's vision has always been to support the local entities and local organizations that are here working and supporting on the grassroots. Since 2005, IDRF has been working here and has supported over 40,000 individuals with different services from healthcare to food aid, as well as economic development for the peoples of Guyana. With this project launch, IDRF plans to have the Guyana Mental Health Project that will support further these local organizations in consultation with the government of Guyana. And our goal is to support over 67,000 people to have better support that they can go out to their communities and support the people of Guyana. Through our partnership with Global Affairs Canada, IDRF is proud to announce, as we heard from our Minister of International Development, Minister Harjit Sajjan, that a multi-million-dollar commitment is being made from the Government of Canada in support of this mental health project. This project has been in inception and in development for multiple years. It didn't just come to fruition overnight. There has been lots of consultations, multiple planning phases, and our team has consulted multiple stakeholders who I wish to thank today. This includes the Canadian High Commission, the University of Melbourne and their entire team at the Wellness Center, the Ministry of Health with Dr. Frank Anthony and his team for constant consultations and allowing us the opportunity to speak to multiple members of the team to form this proposal, the Ministry of Education, the Ministry of Local Government and Regional Development, the Ministry of Human Services and Social Services, as well as our partners, Women Across Differences, the Central Islamic Organization of Guyana, and the Dubai Medical and Research Center. These informative consultations have led to an impactful project design for which the contribution agreement came to place this year. Our goal through this project is not only to meet the objectives we agreed with Global Affairs Canada and the government of Guyana, but to ensure that these project outcomes have a lasting impact on the lives of the communities we aim to support. To do this, we are committed to the following. Ensure all local Guyanese project staff understand the context, the local and regional challenges, and the areas of opportunity where this project can grow. Our work is implemented in partnership with local organizations that work in education and healthcare and are women and children oriented, which connects directly with Canada's Feminist International Assistance Policy. We are guided by the immediate needs of the Government of Guyana, where we are working with key partners such as the Ministry of Health, including the Mental Health Unit, and the Ministry of Education to provide capacity building support to the government staff and to incorporate our project activities directly into their activities and programs. So there is no overlap and there's no replication and duplication. Therefore, our goal is to make this project sustainable and truly localized. And at the end of 5 years, our outcome must be embedded in the government strategy and anchored by local communities to mitigate the challenges that people at risk of mental health face. On behalf of the entire IDRF team, both here in Guyana and Canada, thank you for the opportunity to work together over the next 5 years, and let us leave a lasting impact together. Thank you so much. Appreciate it.
Thank you very much, Mr. Kasim. We're now going to have an overview of the project being done by Ms. Julie Sukram, who is the program manager for IDRF Guyana. She is specifically responsible for leading the implementation of the project, and she has designed, implemented, and monitored and evaluated multicultural programs in both the Caribbean, Asia, and Africa. Please join me in welcoming Ms. Sukram.
Thanks, Roberta. Honorable Minister of Health, Honorable Minister of Health, Dr. Frank Anthony, His Excellency Mark Berman, High Commissioner of Canada to Guyana and Suriname, representatives of the IDRF, representatives of Columbia University, Deputy Representative for UNICEF, Irfan Akhtar, other representatives of United Nations agencies, senior members of the Ministry of Health and other governmental ministries, representatives of stakeholder, non-governmental organizations, members of civil society, members of the media, ladies and gentlemen, greetings. I'd like to start off by acknowledging the points that my colleague Yasmina and Mahmoud have made by providing you with context on the work that IDRF has done over the last 35 plus years. Before I commence my presentation, however, I would like to acknowledge someone who has worked tirelessly with various partners and stakeholders to co-create this project. Unfortunately, he cannot be here today. He is the Senior Director of Operations and Programs at IDRF, Nabil Ali. Nabil, I know you're probably glued to your computer screen looking at this. So on behalf of IDRF, I'd just like to thank you for your astute leadership on the program today. Now I would like to delve into what specifically IDRF Guyana, in partnership with Global Affairs Canada, will be doing through this project titled Safeguarding the Human Dignity and Rights of Populations at Risk for Ill Mental Health in Vulnerable Communities across Guyana. And yes, it's quite a mouthful, but it will be as impactful as the title. Sorry. So our project was born out of an imminent need to address the high rate of suicide that exists in Guyana. And earlier this morning, during the official opening of the GWB conference, we've heard from Professor Christina Hoban, who had reiterated many times that Guyana has the second highest rate of suicide globally. According to the Guyana Mental Health Statistics Department of the Ministry of Health, in 2020, there were a total of 147 deaths by suicide. Vulnerable populations, including women and youth, are at higher risk than male. And this is outlined by statistics which have shown that females have a higher rate of suicide and suicide attempts than their male counterparts. We also heard from Irfan Akhtar, who has underscored that youth are disproportionately affected. And we have pulled some statistics from a UNICEF Guyana report 2020. As you can see, 34.1% of the youth respondents have mentioned that they were regularly depressed. 31.9 felt hopeless, and 25.2 frequently considered acts of self-harm. Notwithstanding these challenges, the government of Guyana has made, I would say, tremendous efforts in order to address the mental health needs of the Guyanese people by assenting the Mental Health Protection and Promotion Act, and more recently passing the Suicide Prevention Bill 2020. And on this note, I would like to extend congratulations to the government of Guyana. However, mental health, as I believe all of the speakers said this morning, cannot be addressed by one agency. It has to be a collaborative effort by all of the key stakeholders. There are gaps to be bridged and support that could be provided to the government of Guyana to develop complementary responsive mechanisms. And in so keeping, the ultimate goal of this project is to enhance the dignity of Guyanese and bolster their right to mental health well-being, particularly young women in vulnerable communities across all 10 administrative regions in Guyana. In order to achieve this goal, the project will increase and improve the availability and capacity of mental health services, both at the community and at the school level, in order to address the high rate of suicide. In so doing, IDRF will employ a partnership model in which we will engage with local organizations to support a community-oriented care approach to mental health and well-being. The model will build on existing social structures and strengths of mental health survivors, mental health workers, religious bodies, and other key influential leaders in the community to work together to charter a path of mental health resilience. Now, in terms of the target beneficiaries, IDRF will target through this project a total of 67,750 youth and adult beneficiaries over the life cycle. And there's disaggregation there of that figure, and it includes 52,500 adults receiving mental health services in 400 public health facilities, 5,750 adults receiving community-based mental health care and support, 9,000 youth in school settings receiving gender-responsive education, and 500 dialysis patients receiving mental health counseling. Now, since the signing of the contribution agreement in January 2022, IDRF has made progress in the implementation of this project. To date, we have been able to establish a vibrant project team. At the helm, we have our country manager, Ramesh Kishan. We also have Kishan Griffith, who is the advocacy and policy officer and also a trained psychologist. And last but not least, we have my peer, our plan and monitoring, evaluation, and learning officer. We have also continuously engaged with key ministries, including the Ministry of Health, Ministry of Education, and the Ministry of Human Services and Social Security. And we have engaged them to understand specifically what their needs are for their frontline workers in order to design programs to respond to those specific needs. We have also signed partnership agreements with two of our key local partners, Women Across Differences and the Central Islamic Organization of Guyana, in order to provide mental health support at the community level and to conduct mental health advocacy. In September, we delivered a strengths-based resilience program, which was facilitated by Dr. Taib of the University of Melbourne. And in Dr. Taib's presentation, which he will make, you'll get a chance to gain greater insight into what that SBR program looks like. We have importantly engaged with and recruited local technical experts, including Dr. Devendra Sharma, who is a consultant psychiatrist, and Shamina Hanif, who is a trained and registered psychologist. And this is an important point to make because we believe at IDRF that the local people on the ground are those people who have knowledge to help us design our programs to respond to the local context and the needs of the Guyanese people. In terms of future programming, IDRF will continue to expand partnerships with other ministries, such as the Ministry of American Affairs and civil society organizations and bodies, such as the Presidential Youth Advisory Council and the Guyana Responsible Parenthood Association. We will also be designing and implementing an advocacy program to support the destigmatization of mental health, and this will include the development of community mental health advocacy plans and community outreaches conducted to help increase awareness of mental health issues. And importantly, we will be working closely with the Ministry of Health to ensure that our support that is provided to the main public health mental health institutions are tailored to respond to their needs. We will also be working with the Ministry of Education to recruit school counselors and ensure that they are trained and resourced to provide confidential support for screening and referral pathways. And last but not least, under the umbrella organization, the University of Melbourne, we will be developing a M&E platform that will support empirical evidence-based program development. Thank you.
Thank you, Ms. Zakram. At this point in time, if you'll permit me, it is my distinct pleasure to welcome and introduce someone who's certainly no stranger to all of us. It is the Honorable Dr. Frank Anthony, who is Guyana's Minister of Health. Dr. Frank Anthony has been a medical professional since 1993 and has worked extensively in the health sector in Guyana, spearheading several transformational projects locally. He's also currently a member of the Executive Board of the World Health Organization and the chair of the Guyana Global Fund Country Coordinating Mechanism. If I continue to list his accomplishments, I will not be finished soon. So please give a warm welcome to Minister Frank Anthony.
Thank you very much. High Commissioner of Canada to Guyana, Mr. Mark Merman, board members of IDRF, Mr. Irfan Akhtar, Deputy of UNICEF in Guyana, Dr. Renato Oliveira, Mental Health Chief at PAHO WHO, other distinguished ladies and gentlemen, the team from Columbia University, and everyone else who are here. I'm very pleased to be here this afternoon. And as I said earlier this morning, Guyana and Canada, we have a very strong relationship. And I think that relationship is even stronger in the area of healthcare. And we have a whole list of projects that we've undertaken together. But more recently, during the COVID pandemic, Canada has really stepped forward in assisting the government and people of Guyana. When we didn't have vaccines, for example, through COVAX, Canada was very supportive. And in addition to that, we've had very strong partnerships with a number of Canadian institutions, including a set of universities who came together in a consortium to offer and to do an analysis of nursing education in Guyana, and also to assist us as we move forward with nursing, the development of the nursing program. We have also had the benefit of working with a number of Canadian universities, including York and McMaster's, so that we can improve medical education here in Guyana. And, you know, this tie between Guyana and Canada is quite a long one. And for some of you who might be interested in a fun fact, the province of British Columbia was actually founded by a Guyanese. I don't know how many of you know that, but there's a gentleman named James Douglas who was actually born in Mahaika in Guyana. And then he left here when he was about 10, went to England, got his education. Then he went to Canada, started working for the Hudson Bay Company, and eventually founded British Columbia for Canada. So we have very strong ties. And therefore, I think having various organizations and representatives of Canada coming to work with us here in Guyana is really a pleasure. As you have heard, IDRF has worked with CIOG and many other NGOs here in Guyana for a number of years. And while they probably would have been silently working with these partners, they have done tremendously good work here. We, of course, have a big challenge in terms of mental health. And this has been a problem that we have been working on for many years. We have seen the numbers go down slightly, but as Professor Hovind would have pointed out, we want to come off that list. We don't want to be number 2 or number 3. We just want to get off the list. And for us to get off the list, we need to make sure that we can educate the population. We need to make sure that we have systems that can detect when people are vulnerable. So we need to understand when people are going through depression, to be able to detect that. And once we are able to detect that, to come up with a plan of how we are going to treat and help those persons. You know, from time to time, various people go through vulnerable phases in life. And if you can help them through that patch when they're having these troubles, you know, they would do well. But sometimes people make rash decisions, and those decisions can be permanent ones. So, for example, committing suicide. We really don't want that to happen. Everybody's life is really, really valuable to all of us, and they have a contribution to make to this country. So we have to make sure that we put the systems in place to prevent suicide from happening in Guyana. The government of Guyana would have taken those first steps. We started by looking at our antiquated suicide laws that we had in this country. And one of those laws criminalizes attempted suicide. So we have been able to decriminalize that. We have now passed the Suicide Prevention Bill, which has now become the Suicide Prevention Act because it has been assented to by the president. And by doing that, we have also put a number of measures within that act to make sure that we can prevent suicide. Harm reduction is an integral part of suicide prevention. When you look at the stats that we're presenting this morning, one of the main reasons or main ways of how people commit suicide is in Guyana is through the ingestion of herbicides and pesticides. Now, we have put a number of mechanisms in place to restrict the use of herbicides and pesticides. And one of the things that we really want to develop is to develop a poison center or a poison prevention center. And meaning that if we bring in a herbicide or a pesticide, then we must also have the antidote being made available. And if somebody, because, you know, there's a critical period, somebody ingests poison, you want to make sure that they get to the hospital in a timely manner. And if they get there in a timely manner, then you can get You can do stomach lavages and so forth to rid the poison from the body. But even with that, you want to have the antidote available. And therefore, we need to, when we are bringing in or importing these herbicides and pesticides, we must have the relevant antidote that is available. There's also a lot of international movement in terms of the types of pesticides and herbicides that can be used. And so you can still have an effect on the pests, but for human beings, it can be less harmful. And therefore, we need to pivot to have those types of substances that are less harmful to people. But these are changes we'll have to make. And with help from you, we will be able to make these changes so that we can prevent these poisonings from happening. We also need really to strengthen the broader mental health effort in the country. And one of the things that we have to do is to strengthen primary health care. A lot of our physicians and healthcare practitioners at the primary healthcare level, they have challenges sometimes detecting persons who are vulnerable, persons who might be displaying signs and symptoms of, say, depression, persons who have suicidal ideation, because we don't ask these questions when people come to our clinics. And because of that, we sometimes don't detect the challenges that people are going through. So one of the training programs that we have with WHO is to look at how we can train more physicians and for them to put what we have trained them on into practice. Because sometimes you train people and they still don't practice what they've been trained on. So this is something that we are working on. And as you can see, a large component of the IDRF program would be working with students, with persons in the community to do a lot of training. And if we do a lot of resilience training, I think we can have our communities better prepared to prevent suicide and other mental health illnesses. By developing stronger communities and building networks in these communities, it's not only going to help us with suicide and mental health problems, but it can also help to create better well-being in the community. And I think, as you can see from the training, the components that they have there will be doing lots of resilience training and other types of training. I meant to ask them that how they came up with 65,750 persons. That's a very precise number to come up with. But nevertheless, we'll hold them to it. We'll make sure that at the end of the 5 years, we'll count and see whether we got 65,750 people. Yeah. Huh? And if they go over, we'll probably give them an incentive. But again, I think it's wonderful to have this team here. And of course, our gratitude to the Canadian government for funding IDRF to come to Guyana to work with us in this area of mental health. And we look forward to working more closely with many other Canadian institutions as they help us to improve the quality of health care that we are giving to our population. So, Commissioner, thank you very much. Thank you to the government and people of Canada. Thank you.
Thank you very much, Minister Anthony. As I had said when I first started that we have several notable persons here. And so at this point in time, I would like to introduce and welcome Dr. Tayab Rashid, who is a senior lecturer at the Center of Wellbeing and Science at the University of Melbourne. Dr. Rashid is also a faculty associate with the Human Flourishing Program at the Harvard University. Dr. Rashid's experience includes strength-based clinical psychotherapy with complex mental health challenges, resilience, and post-traumatic growth. He will be presenting on strength-based resilience this afternoon, so please give a very warm welcome to Dr. Rashid.
Thank you for this opportunity. Distinguished guests and dignitaries. I'm one of the last speakers, and I understand so you've been listening to a lot. So let me engage you in some of the things that we're going to do with students and with communities and give you a little bit of a sample. Let me begin with a thought experiment. Anyone in this audience who has never experienced stress? No, it's an inevitable part of our contemporary life. From COVID to climate crisis, to relationship issues, to stress in traffic. It is everywhere. But how we cope with stress? In order to cope with stress, our minds are not neutral. And let me demonstrate this with, again, 3 mini experiments. Open up any channel, news channel on your digital device. We no longer have paper copies of newspapers. How many stories you will find which are positive? Anyone shout out? I heard very few, right? So our minds are not neutral. That's one illustration. Second illustration I'll give you from the founder of Gallup, Don Clifton, early parts of 2000s. He did this experiment with about 2,000 US parents. So those who are parents here or those who work with children, imagine this scenario. Your child brings a report card. 3 A's, 1 B. Which grade you're more likely to discuss first? Probably I don't need to ask, you're smart people. Most people, as Don Clifton found, was B. And the third experiment is, imagine it's pre-COVID word, and hopefully we'll get some remnants of that back. You're having a discussion with your colleague, and they tell you your presentation or your whatever project you just did was wonderful. They give you several compliments, and you're very happy, right? When they leave with one minor criticism. When you're going back home, what are you thinking about? So folks, mental health is not only about symptoms. Mental health is also about our strengths. And as I learned as a young graduate student from my mentors, Martin Seligman at University of Pennsylvania, that in order to deal with the toughest challenges of your life, you need your highest resources. Without dismissing your symptoms, your challenges, your stresses, we need a more holistic approach to mental health. And that's what I'm going to present on. Sorry for this long overdue. Strength-Based Resilience Program, I'll explain it to you, is very much a Canadian program. I recently moved to University of Maryland at Center of Wellbeing Science, and I'll explain it to you how it came about. The program begins with a narrative of strengths. We asked, especially young people, we tested this program. I was trained at University of Pennsylvania with Martin Seligman, who started this movement called positive psychology. And we brought this program from US to Canadian, especially Toronto, toughest neighborhoods, and we piloted it. And would you know that Toronto District School Board, where I used to work, is one of the most diverse, linguistically most diverse school boards in the world, with more than 120 languages spoken by students and staff. So you couldn't bring a program to Canadian neighborhoods, especially diverse immigrant neighborhoods, where it was all based on Western Eurocentric notions. So that's why the program begins with a very organic narrative of resilience. We ask students and participants to think about a story. And then we move into what some of you who are in mental health would know, CBT, cognitive behavior therapy, which is a second in the infograph. All of us at times, because our minds are not neutral, we bend more towards negativity. We think more about negative things than we think about positive things. So it's important to use some cognitive behavior skills to help our young people to think more flexibly and more accurately, which is the second panel that you're seeing. And I call it usually clearing the weeds. So those who are gardeners in this audience, when you are gardening, will you just clear the weeds and your garden will flourish? No. You need to also sow seeds. And that is the third strand, which is we need to explore strengths for young people because they have been raised on the steady diet of criticism. Criticism from parents, criticism from teachers, and I gave you example from media. So in a very holistic manner, strengths are identified by them, students, participants themselves, by their teachers, by a peer, by a standardized measure, and by a family member, and by a friend, if that is possible. And then we teach them how to use those strengths in solving problems, active problem solving. The last two parts of the programs are positive relationship because, folks, we're not social being. I think we are ultra social being. Think about the highest moments of your life. You were next to someone when you have the highest moments of your life, celebrations, when you accomplish something. So it's very important that the relationship building capacity is strengthened right from get-go. And we are not only relational being, we're also being who seek meaning. So it's also important, meaning in whatever religious context, whatever existential, whatever philosophical context it is. Those research shows robustly those who pursue meaning, who know whatever they're doing is, they know the reason, and then they put this reason into action, which is meaning into purpose. They tend to have higher well-being. So that's the overview of the program. We had the first round of training, which I'll show you the highlights. This is a result of 18 years of work, which I did with Martin Seligman. We published the book. We started working on it 2005 after about 20 randomized studies in which a few of them I was involved. The rest was done independently. We published the manual and workbook. Much like IDRF, my colleagues in England have a similar grant, and we used this approach with psychosis. We published 4 papers, and this is the book. And then we wanted to bring this therapeutic approach more in educational setting. So this big transition is we adapted it for school settings. We did randomized studies, which without boring you with statistics, DBT is a serious condition for our borderline personality disorders, which complex mix of anxiety and depression. And we pitted it with PPT with a strength-based approach. We found some interesting results. Same with the psychosis. And I'll go quickly so you know that what it is, the program. I was fortunate enough to get a big grant a couple of years ago, thanks to our High Commissioner from a ministry, a provincial ministry in Ontario. And we ran the program in some of the most neediest schools in Toronto. My colleagues know Jane and Pincheria. We ran a program there. And these are from 5 high schools in Toronto. And we found the program compared to a control group, decreased the stress, increased well-being, social skills were increased, resilience was increased, And stigma, there's some change, not statistically significant. We did this similar kind of study in post-secondary university student settings. This is a program. We hired a graphic designer, which created these titles of each of the module, which were very multi-cultural and multilinguistic, so they appeal. So the program has been translated in a couple of languages as well. These are 14 modules, each module, and they are manual fulfill the universal design requirement. So it meets people who have different learning needs and challenges. So we also cater those. It can be offered in a number of ways. So different schools in Guyanese with different curriculum or different time needs can offered in a variety of ways. So there's some flexibility. Couple of topics. Some of you might be familiar: growth mindset or fixed mindset. People who are less resilient have fixed mindset. They explain the failures that I can't do anything about it. The program focuses more through skills on growth mindset. We focus a lot on inculcating positive emotions. So think about it: when you're playing, you feel joy. When you savor, you feel grateful. When you are savoring, you also feel a sense of calmness. When you're exploring, you're interested in peace, so forth and so. This is based on tremendous work done by Barbara Fredrickson on positive emotion science. Because positive emotions, what we want to help the young people is cultivate more positive emotions, because when you are experiencing positive emotions, your capacity to solve problems increases. Your solutions become more flexible, your thinking become more inclusive, and you're able to better cope with challenges. We'll work a lot on strengths, and this will be unfolded over the next 3 days in our training over here with educators and people from different sectors. We also don't just talk about strength, we teach students and our participants how to use strengths, because you can't use strengths for kindness everywhere. Because life is complex. So there is a Aristotelian concept of practical wisdom and there we put them in some complex real life scenarios. That how about if your friend is doing something wrong, it's about fairness, or you want to be compassionate. So those scenarios are listed here. Anyone in this audience who hasn't held a grudge? We all carry negative memories. And when our kids in schools carry negative memories, then they have a chip on their shoulder, their entire days can go bad. So if you teach them skills how to deal with grudge and cultivate more gratitude, it can be very helpful to them. There's an activity, as a sample worksheet. And the last few slides, you're going to see the last modules where we do some savoring with memory building, especially in sharing and building positive relationship, how to share with others, especially positive things, how to share with nature. Well, now we're finding nature, from which we are getting away day by day because we are so much glued to the screen. The nature embedded interventions is showing that students who have ADHD, their attention span actually improves when you take them to nature. So this is sharing with others in nature can be very helpful. Mindfulness, of course, every module has mindfulness. Marveling, again, back to nature. Absorption, doing things which they love. Creativity. Again, absorption doesn't have to be creatively like traditional things, but can be something which can be very ordinary, but it deeply engages our students, cultivating the strength of curiosity, mindfulness again. And this is when we came in September, we did the first round of training, and this is some of the pictures of our training. We're thankful to my wonderful team here, Julie, Ramesh, and Mia, and Kishan. They have been very wonderful, and so is Nabeed, who is not here. We have done the first round of training. It's very experiential, and Dr. Lal was here to distribute the certificates. This is our first cohort. We'll have another cohort at the end of after 3 days here. We also measured the level of knowledge before each and every modules, and you see pre and post test differences, but will be more serious evaluation as the program as we roll out. We ask, this is a very important point, Julie made it very sure, made that point. After every module, we ask through app, what will be your ideas? How would you have this program called, this module called Gift of Times will be embedded in a Guyanese context? So we have wonderful ideas were shared with our audience. As we train more people, more localization context will be built. So that will help us to make the program feel we can bring the main ingredients, but it needs to be understand and respect the cultural sensitivities of Guyana. So same with others. And this was the feedback towards the end. It was anonymous feedback. And here are 2 videos. I hope they will be playing. There's 2 videos from our very brief videos. Hopefully they will appear on screen. It's not in the flash drive. All right, but if not, we will be putting those videos on our website. So these are testimonial from our participants. Let me end you on this note. One of my great mentors, Chris Peterson, is not alive, said, the greatest gift that you can give to yourself is not to know what are your vulnerabilities and your weaknesses, because we are designed, we are defaulted towards them. The greatest gift that you can give yourself is to know your strengths and use them adaptively. The greatest gift that you can give others is to know their strengths and use them neutrally. Thank you so much for your patience. Thank you.